I can get like this.
Oh, are we going? Okay. My name is Taylor, and I'm going to be instilling some gentamicin and doing a bladder irrigation through my patient's Foley catheter. So we have an order. I'm going to, before I even go in the room, I'm going to check my order and get everything that I need, all of my supplies. I'll check to see if the patient has any past history with catheters. And then I'm going to go into my patient room and introduce myself and make sure I get her correct name and birth date. I'm going to palpate her bladder to see if there's any distension, ask her if she has any pain or bloating, and then I'm going to check her catheter line, make sure there's no clots, make sure there's no kinks or any sediment or blood clots in the line. Then I'm going to wash my hands, and I'm going to put on clean gloves.
For urine flow, and let's say we saw it, so we just go in a little bit more. So that is ready to go.
Okay. And I'm going to get my irrigation and open that up. Now this is all sterile on the inside, so I need to make sure to be very careful with what I'm touching. Going to pull out
And now I don't have to say
that.
everything I'm touching is not going
And
inside.
there is a
Move this
little
out, throw that away if I want to.
sheet to widen my sterile field.
Get this out. And I would hang it on a part that's not movable, because if I was hanging it on the bar, if they moved it, it might rip out. But I would tape this as well. I need to leave a little. And also I would pull
I'm going to
this
lay that out
to ensure that it's in there.
and set my catheter on it.
I would leave a little room, and usually they have a stat lock, but I would just take with some mobility.
There is
Just for time purposes, and then I would
put that in there. Okay.
immovable
I'm
part.
going to put this out and ready to go,
Ask the patient if
so I have something for my catheter to drain into when I'm done instilling.
it's okay.
And I'm going to put some sterile water into
The catheter placement, and that is the female Yeah.
normal saline. Yeah, sterile water.
You do male. You should say female, like how exactly how far you put it.
And then I'm going to make sure I cover the label and pour some in.
And then, well, you can always say like with the because you're gonna have to say the male one too, like when you describe the
Do I break sterile?
Put that back in there because everything inside of there is sterile.
I know. I was like,
I came around when I did the iodine.
And I'm going to go ahead and pull up. The order is for 60 mils. So I'm going to pull up
I'll watch it.
60 mils into my syringe.
Good?
okay, ready for
Yeah.
Not really too much.
Okay, so for the male, I'll have to do
Okay.
Also for the female, I'm going to go in about 1.5
And I'm going to clean the port where the two connections are.
about another 1 to 2 inches. And now I'm just going to explain the male. You do the exact same sterility field. For the male, you're going to clean differently. You're going to hold the penis at a 90-degree angle. Again,
And I'm going to take this apart.
use your cotton balls. 93, you can start the tip and go in a circular motion out, throw it away. Circular motion.
And then I'm going to put this into a package of sterile gauze to keep the end sterile.
Insert, you're going to lube it and insert all the way up to the bottom.
I'm going to go ahead and instill. Tell my patient she's going to feel some pressure in her bladder.
Okay, also for the female, I didn't mention that when you're inserting, you're going to go about 1.5 to 2 inches, then you're going to see urine, and then you want to go in about another 1 to 2 inches. And I'm just going to explain the male. You do the same sterile field, assess for allergy, assess the site, clean the site. But for males, you're going to clean differently with the iodine. If they're not allergic, you will hold the penis erect at about 90 degrees.
And then I'm going to drop this in our sterile tray and let it drain out.
You'll start at the tip and go in a circle, throw away in a trash can.
And when I go to put these back together, I'm going to clean off the top portion here.
And then leave a little for the mobility. And then do the exact
And
same.
I'm going to grab outside of my sterile tray and walk up the catheter
Good.
and put them back together.
Let's
and then I'm going to ensure that there is no kinking in my tubing. And I would measure this. The goal of the irrigation is to get out almost as much as you put in or more if they have urine in their bladder. And you want to make sure that you're looking for any clots or sediment that might come out. Now, we're going to instill some gentamicin. So I don't need my sterile field anymore, so I'm going to get this out of the way. And the order is for 10 milliliters of gentamicin, and we're going to do that through a closed irrigation. So I'm just going to let that sit there and get my gentamicin out. And gentamicin is an antibiotic from the aminoglycoside class. And some of the things that you would tell your patient to watch for would be some hearing loss or problems, some difficulty walking, and possible urinary problems, and then of course your nausea, vomiting, diarrhea that goes along with many meds. Okay, and I'm going to take my syringe. It would be a clean, sterile syringe. I'm going to draw up 10 mils. And then you would get your clean, sterile needle, put it in there, and then it would still be in the covering so I could sit down on the table. Just move that out of the way and get a prep pad so I can clean off the port. And this port is a needle port, so I'll have to use the needle. Okay. And I'm going to clamp my tubing. And go ahead and insert my needle and instill the gentamicin. Now you do want to warn your patient that this is going to be clamped for 2 hours, so they might feel some bladder fullness, and if they do, we would want them to use our call light to call the nurse so they can let us know so we can unclamp it. Okay. Pull that out, and cap your needle, and we're going to wait 2 hours, and then we would come back and unclamp. Make sure we have good flow, there's no other kinks, assess for the output, and measure that correctly. Make sure they're not having any pain, and that they feel like it's starting to drain. And then you would just secure your catheter onto the side of the patient's leg and come back to assess them if they have any other issues.
Oh, you already have it?